You thought it was just dry skin. But what if it's something much worse? Hi, I'm Dr. David Jones. Let me ask you something personal. Have you ever been woken up at 3 a.m. by a strange itch? Right on your leg, your back, or your chest? No rash, no bug bite. Just a deep, burning urge to scratch again and again, every single night. Most people shrug and say, it's just dry skin. But what if I told you that itch might be your body's first whisper of cancer? I'm not here to scare you. I'm here to warn you, because I've seen it too many times. It starts with a harmless itch. It ends with a diagnosis no one saw coming. Today's video will show you how itchy skin symptoms in specific spots at specific times can be one of the most overlooked early cancer warning signs in seniors if you're over 60, and you've been feeling a stubborn itch that just won't quit. This might be the most important thing you'll hear all year. Stay with me because the clues are quiet, but they can save your life. Part 1. Itchy shins. Mr. Johnson's wake-up call. I remember a cold winter morning. Not too long ago, a 75-year-old man named Mr. Johnson came into my office. He sat down, gave me a little smile, and said, I'm probably bothering you over something small, but my leg just won't stop itching. It's worst around 3 a.m. I wake up and can't fall back asleep. I figured it's just dry skin. Now, I've heard the phrase, probably just old age, more times than I can count. But this time, instead of nodding along, I leaned in and asked, what have you tried so far? He said, moisturizers. My wife even bought the fancy kind. Sometimes I try a warm compress, even rub some herbal oil. Nothing really works. Here's what stood out to me. The itch was focused right on the front of his shins, and only there. It didn't spread, and the itching got worse at night. That pattern rang a bell. I've seen other patients over the years with the exact same complaint, and some of them were later diagnosed with lymphoma. So I looked him in the eye and said, I know this might sound like an overreaction, but I want you to get some blood work done, just to be safe. When the results came back, we both sat there in stunned silence. Early stage lymphoma. I'll never forget the look on his face. Part shock, part disbelief. Honestly, Doc, I thought it was just old age. I never imagined a little itch could be something like this. And you know what? He's not the only one who's ever said that I thought it was just aging. Those words, so simple, so human, have cost many people the chance to catch something serious early. You see, itching from lymphoma isn't like dry skin or an allergy. It sneaks up on you. It might only affect a small area. It doesn't go away with cream or lotion or even a warm soak. And most of all, it tends to get worse at night when your lymphatic system kicks into higher gear as you rest. Imagine this. It's the middle of the night. You're fast asleep, and suddenly your shin starts to sting and itch like a pinprick. You jump up, you scratch, you rub, but nothing helps. The next morning, you brush it off. Probably dry skin. Maybe poor circulation, but then it happens again. And again, night after night, like some broken biological alarm clock. Eventually, you get used to it. You live with it. You call it just part of getting older. But what if it's not? What if that itch is your body's first whisper that something is growing inside? I'm not telling you this to scare you. I'm telling you this because knowledge can save your life. It saved Mr. Johnson's. Because we caught it early, he started treatment right away, and today he's doing great. Plays golf 3 times a week, still tends to his rose garden for his wife out back. Now, if he had ignored that itch, I might be sharing a very different story with you, one. Filled with regret, we live in a world where people think cancer only shows up when you're coughing blood or doubled over in pain. But the truth, it often sends signs much earlier, quiet signs. A persistent itch in one spot, no rash. No reason, doesn't respond to treatment, sticks around for more than 3 weeks, that's not something to ignore. So here's my advice. Pay attention to your body, especially at night. Keep track of when and where the itch happens and how bad it is. If something feels off, get it checked. Don't wait, and please don't blame everything on aging. I always tell my patients, we can't stop getting older, but we can choose to listen when our body is trying to tell us something. Have you ever had an itch like that? If you have, I hope you won't brush it off. And if you haven't, just keep this story in mind. because someday it might be the thing that gives you another year, another decade, maybe even the rest of your life. Part 2. That itchy spot in the middle of your back, just a scratchy blanket, or a cry for help from your pancreas. Let me ask you something. Have you ever felt an odd itch right in the middle of your back? That one spot you can't quite reach unless someone helps you out? Most folks just brush it off, thinking it's from an old mattress, a dusty pillow, or maybe dry skin. Now picture this. Every evening, especially after dinner, you feel that same itch in the exact same spot. Not your whole back, just one tiny area. You change your sheets, get a new mattress, try scented laundry detergent, even put a fresh towel underneath you. But the itch keeps coming back, like clockwork. Sound familiar? That's exactly what happened to one of my patients, Mary Williams, 68 years old. She came into my clinic saying, "Doc, I've turned my whole house upside down. I've cleaned everything, changed, the linens burned, essential oils vacuumed every corner, but the itch won't go away. I thought maybe I was allergic to something, or maybe it was just dust. I even changed my sofa." We chuckled about it at first, but in her eyes I could see something deeper, a quiet worry she couldn't quite put into words, so I asked her. "Have you noticed when this usually happens?" She replied, "Almost always after dinner. No matter what I eat, it starts itching not long after I finish my meal, but the weird part, scratching doesn't help. It feels like someone's poking me from the inside." Now here's the thing, what she described wasn't random. The pancreas, a small organ tucked deep behind your stomach, is one of the toughest places to catch cancer early. It doesn't form obvious lumps. It doesn't cause sharp pain at first. But it does sometimes send out subtle signs, one of them. An odd persistent itch in the middle of your back. Why the back? Well, the pancreas sits right in front of your spine, and some of the nerves from that area connect to your back. When the pancreas becomes inflamed or starts to go through early cancerous changes, it can affect bile flow. They can irritate those nerves and create a strange deep itch in one specific spot on your back. We call this referred pain when something's wrong in one area, but you feel it in another. So I asked Mary to try something. I said, "Gently press your finger into that itchy spot. If it feels heavier, thicker, or different than the skin around it, that might be a sign the problem's deeper, not just on the surface." She tried it. Her face changed. "You're right," she said quietly. "It does feel heavier." Somehow, I didn't wait. I ordered a full panel of tests for her pancreas and gallbladder. And the results, just as I suspected, early-stage pancreatic cancer. Now listen, pancreatic cancer scares even experienced doctors, not because it's more dangerous than liver or lung cancer, but because it's so silent, most people don't catch it until it's already advanced. But in Mary's case, because she listened to her body, to that strange little itch, we caught it early. Today she's had surgery, she's recovering well. And every month she sends me an email with recipes. She's learning to cook again. She once told me that itch saved my life. So if you've been dealing with a persistent itch in the middle of your back, one that lasts more than 3 weeks, doesn't come with any rash or scratches, and just won't go away, don't ignore it. Ask yourself, when does it show up? Does it happen after eating? Do you feel bloated or tired after meals? Have you noticed lighter colored stools or darker urine lately? These might seem small, but to your pancreas, they're the only way it knows how to talk to you. I get it. Nobody likes going to the doctor. Sometimes we tell ourselves, maybe it's nothing, I don't want to overreact. But please remember sometimes that worry, that curiosity might be the very thing that saves your life. All it takes is one simple visit, maybe a quick blood test, and you could either rule it out or catch something early before it turns serious. Think of your body like an old friend. It doesn't always speak clearly sometimes, it just whispers, and it's up to us to listen. So, are you feeling an itch in the middle of your back? If you are, take a moment to jot down when it happens, how strong it is, what you were doing. And don't hesitate to talk to your doctor about it. Because sometimes, an itch might just be the nudge that changes your future. Part 3. Itchy scalp and behind the ear tingling. When your blood speaks before your body feels tired, let me ask you something. Have you noticed your scalp getting itchy lately? Not dandruff, not a shampoo allergy. Just this quiet, persistent itch. Especially when you're lying down to rest. Ever experienced that? I remember one of my patients, Mr. Harris. He's 73, a careful, thoughtful man. Someone who really pays attention to his body. When he walked into my clinic, he didn't bring a regular medical record. He brought a detailed journal, a handwritten diary tracking 3 straight months of itchiness. He set it down and said, "Doc, I don't think this is anything serious, but it feels strange, and I can't ignore it." Mr. Harris described an itch mostly behind his ears and at the base of his neck. No rash, no flakes, no bumps. He tried everything, switched to a gentle shampoo, stopped using conditioner, even washed with just warm water and his hands. Nothing helped, he said. During the day it's fine, but at night, when I lie down, it's like a soft knock on the door. It doesn't hurt, but it keeps me wondering. Here's the thing. That itch didn't come from outside. It came from inside, from his blood. We all know white blood cells help fight off infections. But when your body starts producing too many abnormal ones, like in the early stages of leukemia, those cells can trigger silent inflammation. That inflammation can irritate tiny nerve endings under the skin, especially in sensitive spots, like the scalp and behind the ears. Why behind the ears, you ask? That area is packed with sensory nerves, and it's close to the lymph nodes in your neck. When your immune system starts to act up, those inflammation signals often hit there first, causing a weird itch with no visible cause. When I checked Mr. Harris, I found no sign of skin infection, no fungus, no dandruff. But I did notice subtle signs. He was slightly more tired than usual. He had a bruise that wasn't healing quickly, and a small scratch that took 10 days to close up. These are changes only someone really tuned into their body would notice. I ordered a full blood test and a peripheral blood smear. The results came back, and I had to pause for a moment. His white blood cell count was abnormally high. Mr. Harris was diagnosed with early-stage chronic leukemia. When I told him, he sat still for a long while, then quietly said, "I never thought." The itch would be the first clue, I replied. "And thanks to your awareness, we caught it early. And in medicine, early means a chance." Since then, I tell all my older patients, your body is never silent. It's always whispering to you. The question is, are you listening? So if you ever have an itchy scalp that doesn't come with dandruff or flaking, doesn't go away even after changing shampoo, gets worse at night when you lie down, and comes with things like fatigue, gum bleeding, slow healing wounds, or unusual bruising, don't brush it off tonight. Try this. Use your palm to gently feel your scalp behind your ears, your neck, and the crown of your head. Is there a spot that feels warmer than the rest? Does it feel odd? Like you want to scratch, but it's not quite an itch note. The time it happens. Is it only at night? Do you also feel just a bit more tired than usual? Pay attention to your overall health too. Have you lost weight for no reason? Still eating normally but feeling weaker? Does your skin look paler? If some of those signs match up, I'd strongly recommend seeing a doctor and getting a simple blood test. It only takes a few minutes, but it could give you peace of mind. Or a head start on something important. Mr. Harris is doing well now. He comes in every 2 months with a new notebook, but now instead of an itch diary, it's a healing journal. He once told me, growing older has taught me one thing. I've had to learn how to really listen to myself, and I believe that's true for all of us. The older we get, the more we need to have conversations with our bodies. Not rushed, not dramatic. Just like talking to an old friend, quiet, slow, and trustworthy. So if you ever feel that quiet itch behind your ear or on your scalp, don't just ignore it. It might be your body's way of saying, "Hey, pay attention to me. I'm still fighting for you every single day." Part 4, itchy chest area. It might not be your bra. It could be a sign of inflammatory breast cancer. Yes, even in men. You know, I used to think that only the big obvious things scared people like a lump. You can feel a sharp pain or a persistent fever. But after over 30 years in medicine, I've realized something different. What truly frightens us are the little things, the quiet ones, the things that are easy to brush off, one of those little things. A mild itch around the chest. Let me tell you about Mrs. Davis. She's 69, very thoughtful, gentle, and deeply in tune with her body. That day she walked into my office and said a bit hesitantly, "Doctor, I don't know if this is even worth mentioning. It sounds silly, but I've been getting this itch on the right side of my chest, right where my bra strap sits." I nodded. "How long has this been going on?" "Oh, a little over 2 months. I've tried everything: cotton bras, silk, looser clothes, even no bra at all. But that patch of skin just keeps itching. No rash, no pain, just itchy, and only on one side. Isn't that strange? And that, my friends, is one of the early signs of a rare but aggressive disease called inflammatory breast cancer, IBC for short. Here's what makes it tricky. It's not the kind of cancer that forms a lump you can feel. Instead, the skin on the breast starts to thicken, turn reddish, maybe look a little like an orange peel. Often there's this constant mild itch that doesn't go away, no matter what cream you use or what clothes you wear. I asked Mrs. Davis to stand in front of a mirror with me. Together, we looked closely. Her right breast was slightly swollen. The skin looked a bit redder. Around the nipple, the skin seemed wrinkled and less elastic, and yes, just one side was itchy. We ordered an ultrasound and a mammogram, and the results confirmed it. Early stage inflammatory breast cancer. You know what's scary? This type of cancer progresses quickly, but since there's no lump, a lot of people mistake it for a skin allergy, irritation, or just their bra rubbing wrong. And because it seems minor, or because they're embarrassed, they wait. They delay until it hurts, or the skin changes more drastically, and by then, it's often too late. I've heard so many people say, "Well, I'm getting older. My skin's just more sensitive. I'll just put on some cream." But listen, if you've already changed clothes, tried lotions, even avoided bras, and it's been itching on just one side for more than 3 weeks, please don't write it off as just aging skin. And let's be clear, this isn't just a women's issue. I've seen many men hesitate to mention symptoms around their chest because they think I'm a guy. Breast cancer doesn't happen to men, but it does. Men account for about 1% of all breast cancer cases. And sadly, most are caught late because nobody thought to check I had a male patient once. Mr. Gary, 66 years old, he came in because he had a persistent itch and a reddish spot around his left nipple. At first, he thought it was just dry skin, or maybe irritation from soap. But after 2 months without improvement, he came to see me. The diagnosis, male breast cancer. Fortunately, we caught it early, and today he's doing great. He told me I almost ignored it. I just didn't think this was something men should worry about. I'm not telling you these stories to scare you. I'm telling you because they're true. And catching something early, that's one of the most precious gifts you can give yourself. So here's what I want you to do tonight. Take just 5 minutes. Stand in front of a mirror. Look at both sides of your chest. Do they look the same in size, shape, or skin color? Is there any patch of skin that's been itchy for weeks only on one side and just won't go away? If the answer is yes, please don't wait. See a doctor, ask questions, because peace of mind is priceless, and it starts with listening to your body at the right time. I always tell my patients, getting older doesn't mean putting up with discomfort. It means, you know, your body better than ever, and you have every right to protect it. So, have you been feeling itchy around your chest? Even if it seems minor, don't ignore it. That 5-minute mirror check tonight might just give you many more healthy years down the road. Part 5. When an itch in a private area is your body's serious warning. I know this isn't an easy topic to talk about. The anus or genital area. These are places most people feel uncomfortable mentioning. Especially as we get older, it's common to brush things off. It's probably just hemorrhoids, or maybe a little rash, or poor hygiene. I once had a patient, Mr. Ryan, 76 years old. He'd been living with hemorrhoids for over 30 years. A strong, quiet man who rarely complained, but one day he came into my office looking more serious than usual, Doc. He said this time, "It's different. No pain, no swelling. but it itches. A strange kind of itch. It stays in one spot. I've tried everything, ointments, warm baths, but nothing helps. And the weirdest thing is, it itches. Even when I'm just sitting still, I pause for a moment. Because what he was describing didn't sound like regular hemorrhoids or even a typical skin infection. It sounded more like anal cancer or vulvar cancer, types of cancer that often develop silently with one stubborn symptom, an itch. A sharp, pin-like itch, always in the same place that gets worse at night. People like Mr. Ryan, used to dealing with long-standing issues, tend to ignore new symptoms. They assume it's just the same old thing flaring up again. And that's why cancers in these areas often go undetected until it's too late for simple treatments. So I asked him, have you noticed any unusual bleeding after using the bathroom? Any changes in your stool color, smell shape? Any strange smell or discomfort when urinating? He paused for a moment, then nodded quietly. Yes, but I figured it's just part of getting older. That sentence, just part of getting older, is one of the most heartbreaking things I hear in this profession. I asked Mr. Ryan to get a colonoscopy and a biopsy of the affected area. And just as I suspected, it was early-stage anal cancer. Thankfully, because he came in when he did, we were able to begin treatment right away. Today, he's doing great. He still goes for afternoon walks with his wife. My friend, an itch is not always harmless, especially when it shows up in private areas like the anus, vulva, or around the genitals. Here's what cancer-related itching in these areas might look like. It's always in one exact spot. It doesn't spread. It doesn't respond to regular ointments or warm baths. It's worse at night. It may interfere with sleep. It may come with mild burning while urinating, odd-smelling discharge, or spotting after a bowel movement. I get it. Many people feel embarrassed to see a doctor about this. But please believe me, we're not here to judge. We're here to help before it's too late. Don't let shame cost you the chance to live longer with your loved ones. Tonight, I want you to take just a few minutes and do this. Use a mirror to check your intimate area. Any changes in skin color, a dryness, discharge, take notes. When does the itch happen? Is it always in one place? Is there any burning pain or anything unusual? Think back. Have you used any creams or taken warm baths? Did it help? If the itch has lasted more than 3 weeks, hasn't improved with home care, stays in one spot, and comes with any other unusual signs, please don't wait. I once had a 71-year-old patient who came in after nearly 5 months of dealing with itching in her private area. She tried 7 different creams, changed her underwear countless times, but it didn't go away. When I asked why she didn't come sooner, she just whispered, I was embarrassed. My kids offered to take me to the doctor, but I didn't want them to know. Eventually, we found out it was vulvar cancer. Thankfully, we caught it in time. But if she had waited even 1 more month, things could have ended very differently. I'm not sharing this to scare you. I'm telling you because your health doesn't just depend on medicine or doctors. It depends on the choices you make starting today. Your body speaks to you every day. Please, don't ignore it. Have you ever felt a sharp, needle-like itch in a sensitive spot that just wouldn't go away? If so, don't brush it off as something small, because it just might be the last time your body tries to get your attention before it's too late to make a change. Part 6. When itchy fingertips and soles are more than just a skin issue. You know, there's a kind of itch that most people tend to shrug off, itching on the palms, soles of the feet, or more specifically the tips of your fingers and toes. I've heard all the usual reasons in my clinic. Oh, it's probably just from washing hands too much. Maybe it's the sandals. My feet get sweaty. Could be the dry weather. And honestly, those could be true in some cases, but if the itching keeps coming back with no clear reason and no cream seems to help, then I'd like you to listen carefully to this next part. I remember a patient of mine. Mr. Allen, 70 years old, a retired elementary school teacher. He came in one spring afternoon wearing thin cotton gloves. He smiled and said, Doctor, this isn't anything serious. It's just my hands, they keep itching. It's a strange kind of itch, only on the palms. I've tried creams soaking in water, even switched soaps 4 times. Nothing works, I asked. Just the palms, not the backs of your hands. He said, nope, backs are totally fine. It's just the palms. especially the fingerprints. It feels like tiny needles poking all the time. He also mentioned it got worse at night and came with this odd tiredness he couldn't explain. When I looked closer, the skin on his palms had a slight yellow tint. The lines looked deeper, but the skin was otherwise clear. No rashes, no peeling, no redness. As a doctor, I'd seen signs like this before, and I knew this wasn't just a skin issue. When you get unexplained, persistent itching in the palms or soles, especially at the fingertips or toes, that could actually be an early warning sign of internal disease. Even advanced stage cancer sounds scary, I know. But let me explain. Certain cancers like liver, lung, stomach, or pancreatic cancer can release metabolic toxins or abnormal proteins into the bloodstream. These chemicals travel through the blood and often collect in areas with a lot of nerve endings like the fingertips and palms. The result, those nerve endings get irritated. You feel a weird tingling itch, often worse at night when your body is resting and blood flow shifts. Mr. Allen was very meticulous. He kept notes on everything he tried. Wearing gloves to wash dishes, switching to unscented soap, applying lotion. 5 to 6 times a day, soaking his hands in warm salt water. And still the itch persisted. I suggested a blood test and a liver function panel. And wouldn't you know it, early-stage liver cancer. No other symptoms, just that strange itch. He couldn't believe it. "But doctor, I've been eating fine," he said. And I replied, "That's exactly why we caught it early, because you paid attention to something small before it became something big." Friends, your body always tries to communicate, especially when something unusual is growing inside. Cancer doesn't always start with weight loss or pain. Sometimes it whispers first through an itch, a spot of yellow skin, or a strange new sensation in your fingers or toes. So how can you tell the difference between a regular itch and one that might mean something more serious? Here's what to look out for. Itching focused on your palms or soles, especially the fingertips and toes. No visible rash peeling or allergic reaction. Doesn't respond to creams, lotions, or home remedies. Gets worse at night. Disturbs your sleep. Might be accompanied by fatigue, slight weight loss, yellowish skin, or slow digestion. Here's my advice tonight before you go to bed. Sit under a soft light and gently press your palms. Do you feel anything odd? A tingling, a patch of skin that looks slightly off color. Have you been scratching your palms every night without knowing why? If yes, don't ignore it. A simple blood test. A quick checkup could save you years of healthy living down the road. I still remember when Mr. Allen came back after 3 months of treatment. He looked me in the eyes and said something I'll never forget. "I might have a few more years left, just because I didn't ignore an itch." So are you feeling an itch in your fingertips, palms, or the soles of your feet? If you are, pause for a moment. Tune in to what your body is trying to tell you. Because maybe, just maybe, that itch is your body's way of saying, "Hey, I need you to pay a little attention, and I promise I'll keep working quietly for you." Part 7. That itchy spot in the middle of your back, it might not be your mattress. It could be a cry for help from your pancreas. There are some spots on your body where if you feel itchy, you notice it right away. Your hands, your face, maybe your chest. But then there are those harder to reach areas. Like right in the middle of your back, I once asked one of my older patients, "Is there any part of your body you just never think about?" He laughed and said, "My mid-back. If nobody scratches it for me, I probably wouldn't even remember it's there." We both laughed, but the truth hit me later. That forgotten part of the body is actually one of the first places your pancreas might send out a warning sign when something's wrong. Let me tell you about Mary Williams. She's 68, sharp as a tack, very organized, and really in tune with her body. She came to see me. Not because of pain, not because she was feeling tired, but because of one stubborn, persistent itch right in the center of her back. She said, "Doc, this isn't just a regular itch. I've changed my mattress, my pillows, even my blankets. I've used essential oils, vacuumed every inch, washed the sheets in hot water. My room's cleaner than an operating room. But it still itches. No rash, no redness, just this deep, nagging itch. Like something inside me won't leave me alone." I listened. Then I asked her, "When does the itching usually happen?" She said, right after dinner I thought maybe I was allergic to something. But it happens no matter what I eat, and I asked if she felt bloated, had slow digestion, or a loss of appetite. She nodded. Yeah, especially after eating fried or fatty foods. That's when I knew we needed to dig deeper, because everything she described lined up with early signs of pancreatic issues, maybe even pancreatic cancer. Here's the thing. The pancreas sits deep inside your abdomen, behind the stomach, right up against the spine. So when something's wrong, the discomfort doesn't usually show up in your stomach. It shows up in your back. It's what we call referred pain, where the problem is in one place, but your nerves report it somewhere else. With the pancreas, changes in bile. Flow or digestive enzymes can irritate nerves linked to your mid-back, causing a weird, itchy or prickly sensation in that area. Not quite pain, but not quite normal either. I told Mary to try something simple at home. Place your fingers gently on the itchy spot. Press, slowly breathe deeply. If you feel a heaviness, like the skin's thicker, or like something is pushing from beneath, it might not be a skin issue at all. She tried it right then, during our visit, and she froze. That's weird, she said. It doesn't feel like a rash. It feels heavy. We ran some tests, ultrasound, pancreatic enzyme, blood work, and a CT scan. The results came back a small tumor on her pancreas, early stage. I'll never forget her face when we told her relief, disbelief, and emotion all at once. Thank goodness I didn't ignore it. She said, there were times I thought I was just being silly. Overthinking an itchy back, I looked her in the eyes and said, no. You saved yourself because you listened to your body's signal, even when it came from a place most people ignore. So here's what I want you to take away from this. If there's a spot in the middle of your back that keeps itching at night, especially after meals, and you can't explain it, don't brush it off. You can even do a quick self-check. Do you feel bloated or sluggish after eating greasy foods? Have you lost weight without trying? Is your stool pale or floating with oily residue? If any of these ring true, please don't wait until it gets painful to see a doctor. The pancreas is one of the quietest organs in your body when it starts to go wrong. But that just means the subtle signs it does send matter even more, so if you've got that odd little itch that won't go away, think of it as a message, a gentle knock from within. Don't ignore that message. Open it, read it. And if needed, respond with a checkup. Are you dealing with a nagging itch in your mid-back that won't go away? If yes, do what Mary did. Pay attention, don't dismiss it, and don't be afraid to act. Because sometimes that small itch might just be your big chance to stay healthy and live stronger. Longer Part 8. When one side of a man's chest itches, it might not be nothing. I used to think I'd seen just about every kind of cancer in my career, but it's always the rare ones, the overlooked ones, that end up being the most heartbreaking. Over 30 years of working with middle-aged and older men, there's one pattern I've noticed: they rarely, if ever, bring up anything related to their chest. And when I ask why, the answer is usually some version of, I'm a guy. Men don't get breast cancer. Sound familiar? Maybe you've thought the same thing, or someone you love has. But here's the truth. Men do have breast tissue. Not as much as women, of course, but enough that, yes, they can get breast cancer. It's rare, about 1% of all breast cancer cases. But it happens. Let me tell you about Gary, 6 years old, a former soldier, tough guy, quiet. The kind of man who only sees a doctor when he absolutely can't take it anymore. It was a cold February morning when he came to see me. He walked in a little hesitant and said, Doc, I got something weird to ask. Kinda embarrassing. But I've had this itchy spot around my left nipple for over a month now. Not super itchy, just uncomfortable. Won't go away. I thought maybe it was my jacket rubbing or the soap I use. I asked, did you try switching soaps? He said, yeah, tried looser shirts. Yep, nothing's helped. Then he said something that made me sit up. It started to look a little red, not swollen, not painful, but the skin feels thinner there. I asked him to take off his shirt so I could take a look, and sure enough, the skin around his left nipple was slightly red. It felt drier than usual. and there was a small rash-like spot that hadn't gone away for weeks. Now, this wasn't eczema. I've seen enough of that to know. I sent him for tests, mammogram tissue biopsy, and the result, male breast cancer early stage. Now, just imagine if Gary had let his pride stop him. If he hadn't come to see me, that little tumor could have spread to his lymph nodes, ribs, or worse. In just a few months after treatment, Gary told me something that really stuck with me. If I told this to the guys I served with in the Army, they'd probably laugh. But you know what? I'm just glad I didn't let my ego kill me, friends. If you're a man, or you care about one, and there's persistent itchiness on just one side of the chest, don't ignore it. It could be nothing, but it could be something. Here's what to watch for. Itching that lasts more than 3 weeks, even after using creams, switching clothes, or being extra clean. Redness, roughness, or dryness around the nipple. Only one side is itchy. The other feels completely normal. Maybe even a little tightness or occasional stinging inside the chest. One thing a lot of people don't realize. Male breast cancer often gets diagnosed later than in women, not because it spreads faster, but because men don't think they can get it. They brush it off. Must be from my shirt. I worked out too hard. It's just this new body wash. And in brushing it off, they miss their window to catch it early. So please, if you or a loved one notices an unusual itch, take a closer look. Stand in front of a mirror. Do both sides look the same in color, shape, or texture? Lightly press around the nipple. Feel any thickening itchiness or a small lump. Keep track of when the itching happens. Is it worse at night? Is it waking you up? If you notice any of those things, don't wait. No one's going to laugh at you for getting checked out, but you could lose your chance if you ignore it. Taking care of your health isn't weakness, it's courage. So are you dealing with an itchy chest and just brushing it off because you're a man? If so, I hope today is the day you take it seriously, because staying alive has nothing to do with being a man or a woman. It has everything to do with your heart, your family, and the people who love you. My friend, I hope this message helps you see your body's signals in a new light. Not as annoyances, but as quiet warnings we should respect. Sometimes life doesn't scream through pain, it just whispers through a persistent itch. If you found this video helpful, please hit that subscribe button, turn on notifications, and share it with someone you care about. You never know, your share today might save someone's life tomorrow. I'm Dr. David Jones. See you in the next video, where we keep learning to listen to our bodies and live a little healthier every day. Wishing you peace, clarity, and the strength to protect the most precious thing you have, your health.